If we then connect that a little bit further and we think, well, okay, what are the ramifications? Now, we looked at this a little bit earlier with the Todd-Astorino data when we looked at the VO2 response. But this is going back to that data set where they've got the able-bodied and the spinal cord lesion athletes. We're not going to worry about the fluid replacement, but look at the stroke volume responses. So here we've got our 60 minutes of exercise. And what you can see, here's our able-bodied athletes. The stroke volume, as one would anticipate, it starts quite high earlier on. You get a kind of a gradual decrease in the stroke volume. You see in the spinal cord lesion athlete, you see a similar response, but much smaller stroke volumes. And you see the kind of the net effect of those on the relative cardiac outputs. So why is it that the stroke volumes are much lower and the cardiac outputs are much lower in the spinal cord lesion athletes? Because they're fundamentally a function of the active muscle mass. They're also a function of the fact that these athletes, because they have a reduced degree of vascularization, they've got, we've already seen reduced capillary networks, reduced active muscle mass, they actually start to get a reduction in fluid volume within the body. They actually get have less hemoglobin, they have a reduction in erythrocyte counts. Their oxygen carrying capacity reduces in proportion to the active muscle mass. It is interesting, you know, that if we look at the stroke volume response, it is pretty much attenuated when they give the individuals the fluid replacement in both groups. So again, it's saying actually if you give fluid replacement, it is beneficial to both groups. It doesn't suddenly boost the stroke volume of the spinal cord lesion athlete, but it does have that effect in terms of adding more fluid in, changes the viscosity of the blood, increases to a certain degree both the stroke volume and the cardiac output. If we then go a little bit further and then we look at the heart rate response, so remember that what we saw was we saw a decreasing in the stroke volume over the period of time. If stroke volume is decreasing, but fundamentally, if we just flick back, if fundamentally the cardiac output is remaining relatively stable in both groups. There's a drop here, but it is relatively stable in both groups over the proportion of the 60 minutes. The only thing that can be happening is you're getting an increase in the heart rate response. And you can see it in both groups, but the heart rate response is significantly higher in our able-bodied athletes compared to our spinal cord lesion athletes, because remember that we referred to right at the start of this presentation, we referred to the notion that spinal cord lesion height impacts the heart rate response. So they have a diminished heart rate response in these individuals, which is linked to the injury, but it's also linked to the active muscle mass that's being involved. But you can see in both groups, heart rate increases to compensate, as one would anticipate, for the falling stroke volume. In the scenario where they're given the fluid replacement, you can see that both groups again respond as one would anticipate, as we saw with the stroke volume and the cardiac output. And the author's gone to write this. However, the possibility of the lower cardiac output of the spinal cord injured athlete subjects because of a greater oxygen extraction per given level of cardiac output cannot be excluded. Now, this is quite an interesting point. There isn't a lot of literature on this, but this is one of the things that's kind of been alluded to, which is the notion that actually when you look at kind of VO2 responses between spinal cord lesion athletes, there isn't a significant kind of difference. So why is that the case if the stroke volume and the cardiac output are lower? Well, it's one of the things that's been suggested in the active muscle mass that they are using. They have got a development in things like the AVO2 difference, and they're extracting more oxygen per beat of the heart. One additional reason could be the inability of spinal cord injured subjects to effectively return the blood from the lower limbs and the splenic region, a trait that has been attributed to venous pooling in the paralyzed areas because of a lack of vasomotor tone. So this may help to explain what we see here. That what we start to see is we see this drop off. We see a drop here in our able-bodied athletes, but it's actually more noticeable, the drop in the stroke volume. Remember that those limbs that are injured or impaired below the spinal cord injury, it's not like they have lost complete blood flow. They have got blood flow. There will be blood flowing through them, but because they have lost vasomotor control, they've lost the ability or reduced the ability for things like venous return. So you start to get a blood pooling. Now, if the blood is pooling and it's coming back more slowly from those regions of the body, which are impacted below the spinal cord lesion, then fundamentally you get a pooling of blood and the cardiac output and the stroke volume fall, because there's just a reduction in the total volume of blood. If there's a reduction in the total volume of blood that is being returned to the myocardium, then by definition you've reduced the capacity to dissipate heat. The primary mechanism that we have, one of the primary mechanisms, that we have during exercise for dissipating heat is through the blood. We can distribute that blood to the skin surface to dissipate heat. We've got the sweat response, which is an acute thing that happens in exercise. But if you expose somebody to a hot environment, then the primary mechanism upon kind of arrival is the redistribution of blood flow. But if what we see here happens, which is you get the pooling effect, you've got less overall volume of blood, which means you've reduced the ability to move heat around the body to the skin to dissipate that heat to the external environment. And then if we go a slight stage further, this is quite nice data to just look at, because this is, again, we've got 40 minutes of exercise, and here's the able-bodied and spinal cord lesion athletes, and you can see that the VO2 response, as was kind of been alluded to, is fairly similar in these two groups of athletes for doing the same kind of work. But what you also see is that the able-bodied athletes have a higher heart rate for the same level of work. So if they've got a higher heart rate than these athletes, then these athletes must be, to a certain degree, compensating by either increasing the stroke volume, which is possible, but almost certainly, because we've already seen in the previous slide, the stroke volumes are lower, it will be because they've got a greater extraction of oxygen at the active muscles. So their AVO2 difference is increased. And you kind of see this when you look at the average data here. Look at the VO2 responses between the two groups, okay? And then you look at the heart rate responses between the two groups, and it would almost allude to the fact that it's the AVO2 difference that is the compensatory mechanism. And then if we look at this final part here, which is kind of changes in heart rate over the course of, these are kind of skin blood flow characteristics. So here you've got the kind of the athletes down here, our spinal cord lesion athletes. So this is kind of the percentage of skin blood flow. So their skin blood flow is much, much lower than our able-bodied athletes, and therefore it affects the changes in heart rate. So it gives a greater heart rate reserve for the able-bodied athletes to work across than the spinal cord injured athletes.